What is trauma? Trauma is a deeply distressing or disturbing experience that overwhelms a person's ability to cope. It can result from a single event, such as an accident or an assault, or from prolonged exposure to distress, like ongoing abuse or neglect. Now, trauma affects not only the mind, but also the body. It influences how a person thinks, feels, and reacts to the world around them. Now, there's different types of trauma. Single trauma comes from a single overwhelming event, such as a natural disaster or a violent attack. Chronic trauma develops from repeated exposure to distress, like domestic violence or childhood neglect. Now, complex trauma, that occurs when someone experiences multiple traumatic events, and that's often in interpersonal relationships, leading to deep-rooted emotional and psychological struggles. Now, trauma impacts the brain by activating the body's fight or flight or freeze response. So when the brain perceives danger, it floods the body with stress hormones, preparing for survival. However, if trauma is not processed, the brain can be stuck in this state, and that can lead to anxiety, hypervigilance, or emotional numbness. Some people may even develop post-traumatic stress disorder, and this can include flashbacks, nightmares, and heightened reactions to trigger. Now, trauma can also manifest physically, and this can lead to things like chronic pain, headaches, digestive issues, and immune system problems. Emotionally, it can cause depression, self-doubt, and difficulty trusting others. Now, some individuals turn to unhealthy coping mechanisms such as substance misuse or self-harm. So healing from trauma is possible through therapy, support systems, and self-care. Evidence-based treatments like EMDR, cognitive behavioural therapy, and somatic therapies, they help individuals process their experiences and regain a sense of safety and control in their lives. Recognising trauma is the first step towards healing.